Anemia. Anemia is the blood disorder characterized by the reduction in the red blood cell count, 2. Hemoglobin count, 3. Packed cell volume. Generally, reduction in the red blood cell count, hemoglobin count, and PCV occurs because of 1. Decreased production of RBC, 2. Increased destruction of RBC, 3. Excessive loss of blood from the body. All these three all these incidents are caused either by inherited disorders or environmental influences such as nutritional problem, infection, and exposure to drugs or toxins. Now, classification of anemia. Morphological classification of anemia. Type of anemia in which the size of what is the size of RBC and what is the color of RBC. In that, size of RBC is known by MCV and color of RBC is known by MCHC. MCV means mean cell volume, which is one of the red cell indices. MCHC means mean cell hemoglobin concentration, right? MCV is measured. MCHC is measured in grams per deciliter. Grams per deciliter. Type of anemia: normocytic, normochromic, in which size of RBC is normal and the color of RBC is normal. And type of anemia, second one is normocytic hypochromic anemia, in which size of RBC is normal and color is less. And in microcytic hypochromic anemia, the size of RBC is large and the color is less. In microcytic hypochromic anemia, here the size of RBC is small and the color of RBC is less. Now, etiological classification of anemia. Now, type of anemia and causes and morphology of RBC. Now, hemorrhagic anemia. Now, its causes is due to acute loss of blood or chronic loss of blood. The morphology of anemia, RBC is in acute loss of blood is normocytic, normochromic, whereas in chronic loss it is microcytic and hypochromic anemia. Second one is hemolytic anemia. Hemolytic anemia is due to the destruction of the RBC. Increased destruction of RBC causes is now extensive hemolytic anemia causes are liver failure, renal disorder, hypersplenism, and burns, infections such as hepatitis, malaria, and septicemia, and due to drugs such as penicillin and anti-malarial drugs and sulfa drugs, and due to poisoning by lead, coal, and tar. Another is and presence of isoagglutins like anti-RH, and another cause is autoimmune diseases, especially rheumatoid arthritis and ulcerative colitis. And the morphology of RBC in this is normocytic, non-normochromic, right? Now, another type of anemia is the nutrition deficiency anemia. which is due to the environmental influences. Here the causes is iron deficiency, protein deficiency, vitamin B12, and folic acid deficiency. In this, the morphology of RBC in iron deficiency is microcytic hypochromic, and in protein deficiency there is micro macrocytic hypochromic, and in vitamin B12 there is macrocytic normochromic or hypochromic anemia. In the vitamin B12 deficiency anemia and in the folic acid deficiency anemia, you get the megaloblastic, the hypochromic RBCs. And another type of anemia is aplastic anemia. Here the cause is bone marrow disorder, and the morphology of RBC is normocytic normochromic. And another type of anemia is anemia of chronic diseases. Causes is 1. Non-infectious inflammatory diseases such as rheumatoid arthritis, which is a autoimmune disease, and 2. Chronic infections such as tuberculosis, and 3. Chronic renal failure, and 4. Neoplastic disorders. Example: Hodgkin's disease. Here the morphology of RBC is normocytic normochromic. Signs and symptoms of anemia: skin and mucous membrane. The color of the skin and mucous membrane becomes pale. Pale means lighter color. The paleness is more constant and prominent in buccal and pharyngeal mucous membrane. Conjunctiva, lips, ear lobes, palm and nail beds. Skin loses the elasticity and becomes thin and dry. Skin loses the elasticity and becomes thin and dry. Thinning, loss, thinning, loss and early grayness of hair occur. Thinning, loss and early grayness of hair occur. The nail becomes brittle and easily breakable. Cardiovascular system. There is an increase in heart rate, that is tachycardia and cardiac output. Heart is dilated and cardiac murmurs are produced. Dilated with hypertrophy, without hypertrophy, right? The heart is dilated in the sense with hypertrophy, I think. The heart is dilated and cardiac murmurs are produced. The velocity of blood flow is increased. Coming to the respiration, there is an increase in rate and force of respiration. Sometimes it leads to breathlessness and dyspnea, which is that is difficult in breathing. Oxyhemoglobin dissociation curve is shifted to right in anemia. Coming to the digestion, there is anorexia, that is loss of appetite, nausea, that is feeling of vomiting, and there is a vomiting, abdominal discomfort, and constipation are common in pernicious anemia. Pernicious anemia, why it is occurred? Right, in pernicious anemia due to iron deficiency, right? Or folic acid deficiency. In pernicious anemia, there is atrophy of the papillae in tongue. In aplastic anemia, which is due to the bone marrow disorder. In aplastic anemia, necrotic lesions appear in mouth and pharynx. Metabolism. What happens to the metabolism? The BMR, that is basal metabolic rate, increases in severe anemia. Coming to the kidney, renal function is disturbed. Albuminuria is common. Now coming to the reproductive system. In females, the menstrual cycle is disturbed. There may be menorrhagia, oligomenorrhea, or amenorrhea. Now coming to the neuromuscular system. Common neuromuscular symptoms are increased sensitivity to cold, headache, lack of concentration, restlessness, irritability, drowsiness, dizziness, or vertigo, especially while standing, and fainting. Fainting in the sense syncope. Muscles become Now coming to the muscles. Muscles become weak and patients feels lack of energy and fatigued quite often and quite easily.